Hello, my name is Ann Rhodes. I'm a registered dietitian. Today we're going to be discussing problem behaviors often encountered with a client who has dementia when you're trying to feed them. We'll also be discussing interventions that might be useful in counteracting these problems. Clients with dementia are at high risk for poor nutrition and for weight loss. They can be quite difficult to feed or to encourage to eat. Some recent research has shown that people with Alzheimer's disease actually need more calories than people of the same age. However, due to their disease processes, they often forget to eat, don't realize they're hungry, have trouble using utensils, are resistant to being fed, can't sit still long enough to complete an entire meal, or may not remember how to chew or swallow. As caregivers, we want to keep our clients as independent as possible, and yet we also need to ensure that they are eating. We also need to remember to treat our clients with memory losses with respect and dignity, and to speak to them as they are adults. It's often easy to talk to a client as if they're a 2-year-old because they're acting like a 2-year-old. But we have to remember that they are adults. Join us in the dining room while we observe a caregiver serving some clients. Watch the first of each scenario where the caregiver ignores the problem behavior or actually contributes to it. Then the second scene where he will be intervening appropriately. The first scene will be showing distractions. Often a client with dementia will be distracted by other people, by playing with non-food items or food items. Noise can be a distraction, or if they're given too many choices. In this first scene, see if you can pick out some of the problems.
Hi, Mr. Jones. Mr. Jones. Mr. Jones, we had some beverages today. What would you like? We have some coffee.
I have a coffee.
Soda, milk, tea. What would you like? What would you like?
I get coffee.
Coffee?
Coffee.
You don't have to have coffee. We have milk.
Now watch the caregiver interact more appropriately. He might move a client to a quieter area, or not place two clients next to each other so they can't be touching each other. Remove items that are distracting. A client with dementia doesn't need an attractive centerpiece on the table. Have quiet music. Use soft voices in the dining room. And limit choices. Don't ask them numerous questions. Give them 1 or 2 choices.
Yeah, you can go talk to me. That's right.
Hi, Mrs. Smith. How are you today?
I'm just fine.
Good. Hi, Mr. Jones. How are you today?
Hi.
What you got there? What are you playing with?
I got this.
Can I see what you... That's it?
You can. All right, you can.
All right, thanks.
Yeah, you can have it.
Oh, would you like something to drink today? We usually have coffee.
I have a coffee, please. Give me that. I have a coffee, please. Give me the coffee.
Okay.
Give me some coffee.
The next problem behavior can be inappropriate actions. A client may be jumping up and down from the table or banging on the table. It might be mixing their foods together, or eating non-edible food items. Frequently, a client with dementia will hide foods. They'll either put it in their pocket or put it in a purse. They might be eating non-finger foods with their fingers. Some clients will only drink their liquids or only eat one food item or smear the food item all over their face. See what the caregiver is doing in this first scenario.
food. I don't want my food. I want my food. I want my food. Where's my food?
Here you go, Mr. Jones.
Oh.
Settle down now. You got your food. Here you go.
Oh.
You can sit down now.
Oh,
Jeez.
okay, I'll sit down now.
Here's your food now.
Oh, that's
In that scene, the caregiver was not very effective, was he? Just kind of ignored the situation. A better way to handle things would be if you have a client who is impatient, banging on the table, constantly getting up, try to feed them first. Give them their food immediately. Again, if a client is eating non-edible items or playing with things, remove those items from the table. If they're hiding food, ask to hold that food for them. If they're not willing for you to do that, don't force them to, but then possibly remember later on to get that food back from them when they go back to their rooms. If a client is having trouble using proper utensils, help them, guide them, cut their food up for them. Cue, say, oh, Mr. Jones, you might want to use your fork, or let me put this in your right hand. For mixing food together, offer one food item at a time. This frequently works with patients who are confused. They can know what to do with one food item. If they get 3 or 4, they get confused. Now watch where the caregiver is using some interventions to get the mealtime to go more smoothly.
Where's my food? Where is my food? Where is my
Hey, Mr.
food?
Jones. I brought your food first,
Oh,
since you're so
God.
hungry.
Very good. Very good. Oh, yeah. So,
Here you go.
Oh, hey,
I'll be right back with your food, Mrs.
Oh.
Smith.
okay, but, you have them here, see?
Here you go, Mrs. Smith. How are you today?
Thanks.
Good. Mr. Jones, let me help you with that.
Oh, okay, okay, yeah.
Here.
Okay,
Here you go.
uh,
Let's cut this up a little bit for you. There you go.
that's right, that's, I'm glad to have it.
What do you got there, Mrs. Jones? Can I see? Can I hold that for a little bit? Thanks. So how are you today?
I'm just fine.
Good. Did you try your meal yet?
A third problem behavior with a confused client may be that they just sit and don't know what to do with the food, or they may refuse to open their mouth. Often you'll see someone just staring. They don't even know how to initiate the mealtime. Or a client may be falling asleep at the mealtime. They may actually put their head into their plate. You'll be seeing a scene now where the caregiver is not very effective in any of these manners. Watch and think about what you would do differently if you were the caregiver.
Mrs. Smith? Wake up, Mrs. Smith. Come on. Come on, wake up. It's time to eat. Why aren't you eating? Come on. These are really good. Come on, eat it. Why don't you want to eat it? Just take a bite. Come on. Come on. Fine. Guess you're not going to want to eat today.
The caregiver was not very patient, was he? He certainly didn't spend any time trying to get this client to eat.